initiative, as well as other partners for supporting the PTF to fulfill its duty to the Nigerian people. To conclude, I'd like to briefly mention the issue of the 181 students and staff of a private boarding school in the Lekki area of Lagos that have tested positive for COVID-19. This brings to the fore the risk associated with relaxing some of our restrictions, which we are very much aware of and continue to monitor closely. I would like to encourage state governments, just like the Lagos state government, to continue to take appropriate steps in monitoring and ensuring that incidents of this kind are managed well in line with national guidelines for treatment. There's no doubt we must continue to remain vigilant as more schools reopen across the country. So in light of the achievements, we cannot get complacent. We are far from reaching the promised land. COVID-19 is still very much around with us. We know that we have lost more than 1,000 Nigerians to the virus, and we continue to mourn every one of them. With the case fatality rate in Nigeria standing at just below 2%, we know that we must continue to do more to prevent further losses. For this reason, I urge you all to please continue to follow safety measures at all times diligently. Thank you.
Thank you, National Coordinator, and all previous speakers. The time has now arrived for us to take questions. I hope we are ready. So let's take the very first question.
Good evening. My name is Gloria Mezeke from Channels Television. My question is to the National Coordinator. Are you concerned about a possible spike in the number of COVID-19 cases as a result of the End SARS protest? Thank you.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ude. I report for Arise News. And my two questions are actually directed at the National Coordinator, Dr. Sani Aliyu. Yes, with the reopening of the NYC camps, yes, you have spoken about the fact that they will get tested. But social distancing, that will still be a challenge. How do you intend to achieve this in the camp, if that is even possible? And also, staying with you, with the new protocol as we enter the new phase, we expected some update, especially as it concerns airports, aside from the Abuja and Lagos, especially the international ones in Kano and Port Harcourt. We want to know if there's any update with regards to when they will be allowed to resume international operations. Thank you.
Good evening all. Rachel Abuja from the News Agency of Nigeria. My first question is for the coordinator. Sir, I would like to know if the country is well kitted to sustain free testing and treatment of COVID-19. If no, what other alternative are we looking at? My next question is for the DG representative. Why do we have rapid test kit flooded in the Nigerian market at the moment and already being used by some Nigerians, despite the evidence revealed by the medical lab scientists on poor performance of these rapid test kits? I would like to also know if the supply for rapid test kit by WHO is among those rapid test kits that were validated by the medical lab scientists. Thank you very much.
Thank you very much for those questions. It seems today we're going to stay with the National Coordinator mainly and the representative of the DG and CDC. And at the end, we'll have closing remarks from the Chairman. So may we invite the National Coordinator, Dr. Aliyu.
Thank you. So yes, we are concerned about the impact of the of what has been going on our incidence of new COVID infections in the country. We are monitoring the situation in terms of testing closely, and we continue to urge all, young, old, the vulnerable, to please be careful. Any mass gathering of any sort is an event amplifying situation for COVID-19. And COVID is still very much around with us. We don't want to get infected and carry the infection to our loved ones, especially those at home that might be vulnerable. In terms of social distancing, quite right, Amaka. Social distancing will be a challenge, but the way we hope to implement the NYC camps is we will apply what we call a sort of, they will be in platoons, so it's called platooning or bubble effect, where a set of a team would remain within themselves. They will not be interacting with other teams in the camp. So if we have an infection within that single platoon, we don't need to close the whole orientation camp. We will just isolate those that they are in contact with. And the same will apply to living quarters, etc. And we've also reduced the average number of corpus that are in orientation camps. That's why it's going to be staggered. So, and even when it comes to living quarters, for instance, there will be that, we'll ensure that there is distancing when it comes to the living quarters, as well as keeping the windows open, etc. So it's not just physical distancing alone, it's actually all the other measures that will come into place, such as hand washing, such as the use of face masks, and in addition to that, the testing as well that will happen. With the testing, we're looking at having a two-step process. We will use the rapid antigen test as well as the PCR test on every NYSC member attending. The rapid antigen test result will be available within 15 minutes. So as you come into camp, you will be tested. If you are positive based on the rapid antigen, straight away you'll be excluded. If you are negative, we will wait for the PCR test, which we know is a lot more sensitive and will take 2-3 days to come back. And then if you are positive, you will be excluded from camp and you will be taken into isolation and managed appropriately. So those multiple steps will definitely reduce the risk of transmission of COVID within the camp itself. Update on airports, yes. So we have been working very hard to see how we can open up the remaining 3 airports. We've already got an arrangement with CARCOVID to help with some of the infrastructure as it relates to internet services in these airports, because that's really critical for the functioning of the travel portal itself, as well as the supply of IT equipment for the port health staff. We are also engaging more surge staff in these airports, but one of the real critical issues we are facing now is the issue of laboratory capacity in the three locations. We've been able to get, at least for Kano, we have a private laboratory that's just engaged with Kano state government and will be able to provide testing for passengers coming through Kano. For Port Harcourt, there's one private lab that's currently in the process, but we will urge the River State government to please engage closely with private laboratories to see if we can open up private laboratories in Port Harcourt. Because really, this is going to be the main critical block when it comes to quickly opening the airports. We need to be able to, with certainty, say that we have enough capacity in Kano, Port Harcourt, and Enugu for testing in order for us to open the airports fully. But we'll continue to engage with the Ministry of Aviation as well as the relevant state governments. But again, I will urge the state governments to please help us support this process. The more private labs opened, the easier it will be for us to push the cost of the test as well down. If you have just one lab, it's more difficult for the negotiation between the state governments and the private labs. Rachel, you talked about how do we sustain free testing of COVID-19. Well, there's no doubt once COVID is over. And this is just my view. I really don't think it's possible to sustain all 36 molecular laboratories in the country. It will not be sustainable for a lot of the state governments. But while we still have a pandemic going on, it should be possible, working both within our own budget as well as the donations that come from our partners, to make sure that there's enough in terms of test kits, supplies, etc. for COVID. And things are changing. I'm convinced that the 2 rapid tests that have been authorized by the WHO now, the rapid antigen tests, will turn out to be very useful in the clinical setting. So in fact, what will probably happen is the molecular testing will at some stage become a second step confirmatory testing, and most of the testing in the health facilities will switch over to rapid antigen testing. The exercise we'll be doing with the NYC will confirm how well these rapid antigen tests work versus PCR, and will give us the confidence to roll them out massively across all the health facilities in the country, so that every accident and emergency has access real time to COVID-19 testing, and the results will be available within 15 minutes, so that they can isolate patients as they come in, and they will be able to manage them accordingly. Thank you.
Thank you. Rachel, you asked about the test kits.